The study that I will present at ASCO is testing the idea that women who present at diagnosis with breast cancer that has spread beyond the breast to other organs may benefit from treatment of the tumor in the breast. So classically, the approach has been that once the tumor has spread to other parts of the body, the breast tumor is not that important any longer, and treatment of the breast tumor would not improve survival. And so the treatment should focus on medical therapy for the cancer that is in other parts. But about, I don't know, 15 or so years ago, we looked at some information from a large database that suggested that perhaps it is important and it is useful to treat the primary tumor in the breast, and that women will benefit from that treatment. So there are always problems in interpreting data that is retrospective, that hasn't been accumulated to test a specific idea. And so there were many biases in that data and in subsequent other studies that were published that showed similar results, suggesting benefit for treatment of the breast tumor. So there were a number of clinical trials started that randomized women to testing this idea formally by randomizing them to either a group that continued their medical treatment without specific therapy for the primary tumor site in the breast, and those that were treated for the breast tumor as well as the systemic therapy. And so our trial to be presented at ASCO is actually the third in this series. Two previous trials have been published and have shown conflicting results, one showing no benefit of treating the primary site in the breast, and the other showing a benefit. And so our trial matured recently, and we are presenting the results of this analysis. We have a randomized trial where women were assigned to either continued medical treatment or surgery and radiation for the breast, plus continued medical treatment. We did not find any benefit related to the use of surgery and radiation for the primary tumor. So the survival in the two arms was exactly equal, in fact. And there was no suggestion that treatment of the primary tumor benefited women. It didn't seem to harm women overall either, but clearly there was no benefit. And since all treatment carries some cost, surgery and radiation to the breast carries some cost. So if there is no benefit to it, then clearly it is not something that should be pursued. So one of the secondary endpoints, an important secondary endpoint, was whether treatment of the tumor in the breast improves quality of life. So women who have a tumor in the breast and are being treated with medical therapy, chemotherapy, or anti-hormone drugs or other drugs for their overall disease, disease in other sites as well. So those women can often see a shrinkage of the tumor in the breast related to that successful medical therapy. But sometimes the tumor in the breast will progress, and so it can cause unpleasant symptoms. So it's an unpleasant experience for a woman to have a tumor that's growing in the breast. And part of the idea that we wanted to test was whether the removal and treatment of the tumor would improve a woman's quality of life, even if it didn't improve her survival. So the main endpoint was overall survival, but a secondary endpoint was quality of life. So we compared quality of life in the two arms, those who got surgery and radiation for the breast and those who didn't. And we actually did not find any difference in the quality of life either. So the quality of life was impaired to an equal degree. It was not markedly impaired by the tumor in the breast, but it was impaired to an equal degree in women who were treated for the tumor and those who weren't treated for the tumor. And the reason probably is that in women who get medical therapy, medical therapy really is improving to the point where it keeps the tumor controlled in the breast as well for a large number of women. So those who progress to the point where the tumor is actually bothering them in the breast are relatively few. And I think overall, that's probably why we didn't see a difference in the quality of life. There are also people who feel that just the idea of having the tumor in the breast is a burden. And so it's something that the woman can see and feel sometimes. And so just removing the tumor and relieving her of, being aware of the tumor in the breast would be an advantage. And that does not seem to be true. So women did not report any increase in their quality of life overall, regardless of whether the tumor was removed or left alone. So I think that this has been a controversial area for many years now. Certainly for the last 15 or 20 years, it's been something that physicians have debated and that patients have found intuitively appealing. So when this idea was first presented and discussed, many women felt that it made a lot of sense to have the tumor removed and treated in the breast. And so I think for those women, it will be useful to know that the burden of the local therapy, going through the surgery and going through the radiation, actually does not give them any objective advantage, both in terms of survival as well as with regard to quality of life.